Hello everybody, my name is Mariana Hargreaves. I'm a commissioning manager in Sheffield and I have been for some time, and I think actually that was probably part of Hayley's thinking to ask me to contribute today, because we've heard a lot today, haven't we, about sharing experiences. We've heard from patients, we've heard from professionals, we've heard a lot about sharing learning, so we've heard from different areas of work across South Yorkshire and beyond. And I think one of the things I wanted to talk about was thinking about survivorship from different perspectives, so thinking about it from a commissioning perspective, conscious that a question that quite recently I've had to ask myself is, why should commissioners really be interested in survivorship? And the button worked, brilliant. So lots of the reasons that we've heard today, really. So we know that an increase in incidents, we know that we've got an increasing number of survivors. Apologies if I move away from the microphone. We also know that the way that we currently work hasn't always enabled us to be able to really work with patients to identify their needs and put things in place to think about how we support those with those. And I think from listening earlier today, we're really listening to patients, and we need to continue to think about how we do things differently. What we heard earlier is that we continue to have unmet need. Also, I think there's an acknowledgement that the way that we do things is unlikely to be sustainable in future, and so we need to be open about that and think about actually what are our opportunities. And what you've heard today is actually a lot about how we've tried to think about taking different approaches to implement different ways of working with patients. We've also got the recovery package, and you've heard quite a bit of detail about that today and how that's been implemented in different places. I think really, in essence, for me, that's kind of bringing together what we know about best practice around this. And from a commissioning perspective, that's what I think we should be looking to commission in future. I think there are lots of other things that from a commissioning perspective kind of fit with regard to survivorship. So if we're thinking about where we are with the NHS at the moment, so increasing pressures, and how we need to continue to think about how we make the very best use of the existing resources that we've got in the system, we need to see how the linkages fit on a broader scale. So we think about 5-year forward view, if we think about things like the cancer strategy that we're all looking forward to receiving shortly, if we think about commissioning from the perspective of long-term conditions as a whole, there's real fit with survivorship. And we'll talk a little bit just at the end here around commissioning for long-term conditions, and some of that's where I kind of come from today. So we saw some really good slides, I think, earlier from Macmillan that actually really illustrated this, that we know that people that have had treatment for cancer and are living beyond cancer live with the consequences of their cancer or their treatment, but also live with other long-term conditions and multiple long-term conditions. And actually that's a growing group. And that led me to think about, okay, so from a commissioning perspective, how commissioning's developed for people with long-term conditions has all been about thinking about how we enable care to be more person-centred, how we promote health and well-being, how we enable people to self-care, and by that I mean empower them and really equip them. It's all been about how we work differently with patients and how we look at building processes that enable collaborative care planning with them, that we look at goal setting. And I think the lady earlier today who's left us, unfortunately, when she was talking about what she wanted to do in terms of being able to get to a place where she could go running again, that really kind of hit home with me. And I think there's need for us to continue our kind of increasing focus with respect to outcomes. And by that I mean outcomes that people want for themselves as well as those that are kind of, professionally informed. So when I thought through all of that, I thought actually there's real alignment between the kind of direction of travel, the journey you guys have been on with respect to survivorship, and the direction of travel with respect to commissioning for long-term conditions as a whole. And there was something for me about challenge of how we, where it's appropriate, bring that together, because ultimately we are talking about the same people. I think I'd like to kind of finish on that point and just say thank you for letting me join you today.